the experts, we're connecting with you. This is Connect by 3 News.
And hello again, and welcome to 3 News Connect. We continue broadcasting from our homes alongside Monica Robbins virtually. I'm Jay Crawford. We want to keep everyone up to date and connected right now. And for the next 30 minutes, we'll do as we do every day, and that's bring you the very latest news and information on the coronavirus. With that being said, happy Friday to all. Hello again, Monica.
Hi, Jay. Yeah, we made it through another week, and we start each day, of course, with the biggest headlines about COVID-19, and here are the latest developments. 6 inmates inside the Cuyahoga County Jail have now tested positive. They are all housed in the same area, but the jail is investigating to see who they may have had contact with. The CDC is expected to release new guidelines today, advising anyone who lives in an area of high community transmission, such as New York City, to wear cloth masks. And after 27 days at sea, 2 cruise ships have docked in Fort Lauderdale. There are at least 45 suspected coronavirus cases on these ships. Healthy passengers will be able to disembark, and special charter flights will take them home. Several of the sick people were already taken to an area hospital. The others will remain on board.
My goal for all Ohioans, for myself, my family, for all Ohioans, is that we make it, that we get through this, that we live through it.
Governor Mike DeWine taking more action in the state of Ohio to help stop the spread of the coronavirus. He and Dr. Amy Acton placing and signing a new order to extend the current stay-at-home order until at least May 1st. And beginning Monday night, there are even more changes coming. Businesses need to establish a number of people allowed in their building at one time in order to avoid overcrowding. And there's new issues for people coming into the state after traveling.
Anyone who is traveling to Ohio, coming into our state, we ask them to quarantine for 14 days. Stay home.
This will have an impact on the so-called snowbirds who are returning from Florida, Arizona, and other warmer climates after being there for the winter. Well, it is decision time for many who have loved ones in nursing homes. As coronavirus cases pick up in those facilities, the question now is what they do next. It's a heavy one, too. Channel 3's Dorsina Drakeford spoke to a family dealing with that and tells us what nursing homes are doing to keep residents safe.
My mom is a resident. It'll be a year, I believe, in May.
Kathy Rex lives in South Carolina, but her mom is living in Aurora at Anna Maria, receiving 24/7 care at a nursing home and assisted living facility. As of Thursday, they reported 14 cases of coronavirus, 4 of them employees, and the first death.
I'm in healthcare, so I certainly understand the severity of that. Of course, the first thing that comes to your mind is Washington State.
Early on, King County was the epicenter, with more than 20 residents at the Life Care Center of Kirkland dying after exposure to coronavirus.
Not only is it, I guess, an example, but it's also a learning experience.
Pete Van Runkel from the Ohio Healthcare Association says they're planning now to avoid what could happen later, but it's not easy with the hurdles the healthcare industry is facing.
This disease is transmitted from people who have no symptoms, or it can be. Another huge challenge that we're facing is the PPE, personal protective equipment. We really need that to protect our workers.
Since the state mandated temperature checks and halted visitation, facilities are complying, but it's not a fail-proof method.
We did have my mom tested on Saturday, and she came back negative. However, today she's not in a good state. She's coughing and she's saying she's not feeling well.
For Kathy and her family, that is the worst case scenario, and the options to help are even more limited.
Right now, she's quarantined in her room with the door closed, which is very concerning. She's not very mobile.
Nursing home facilities already starting to recruit new employees due to short staff, but it's all in preparation for when the surge does hit.
It's tearing us all apart. We don't want our mother to die alone. I mean, that's, I think, the biggest fear. We don't want her to die alone. And that's really a hard thought. It's a hard thought.
Dorsina Drakeford, 3 News.
Wow, gut-wrenching. Dorsina, thank you very much. Drive-through testing sites are quickly dwindling here in Northeast Ohio. In fact, one doctor at Cleveland Clinic says they've basically shut it down. The reason, too many people were using them that didn't need it. Many were coming through without having symptoms or just generally worried that they have the virus. Add that to the fact results were taking way too long to get back, and hospitals have dramatically improved their turnaround times in tests. At this point, it's expected drive-through testing will be reserved for certain cases like first responders, high-risk groups, and hospital employees.
Jay, Giant Eagle is making more changes. They just launched an exclusive shopping hour for first responders. Every Thursday and Friday, the stores will open an hour early at 6 a.m. for police officers, firefighters, and paramedics. The chain also announced they will be closed Easter Sunday to give their workers a very well-deserved break. And the city of Berea is hosting a food drive. It's happening now, but it ends at 1 p.m. Here's what you need to know if you'd like to help. You can drop off donations at the Berea Recreation Center on Front Street. Workers will come to your car to collect those donations, and they will be wearing gloves and face masks for everyone's protection. Then the food will be sorted and passed out this coming Tuesday, also at the Rec Center. We have more info for you at WKYC.com. And there are some communities not getting a lot of attention during this crisis, and that's the senior and the homeless community. Lake County has a large senior population, and the homeless community is larger than you'd think. United Way of Lake County has created an emergency relief fund to help meet their needs.
A lot of our senior folks either can't get out or are, quite frankly, terrified to go out to get their essentials. You know, a lot of them are homebound. We are funding a shopper program, which is being run through Lifeline and Council on Aging and the RSVP service and Lake Tran. That's our local bus line. So what they're doing is they are shopping for these homebound seniors, and the ones who cannot afford to pay, United Way is going to fill in that gap, and United Way is going to get food to the door of those seniors who otherwise would not be able to get essential food.
United Way is also taking a different approach on helping homeless shelters, as it's not quite business as usual amidst the physical distancing.
The communication and making sure that people understand how serious this is, and the order from the governor to stay in place, to practice social distancing. So there's a big communication piece for all of that too. Yeah.
For any help from any United Way across Northeast Ohio, all you need to do is call their hotline at 211. Jay?
Monica, here's another one of those stories that really shines a light on how much people are doing to help the cause. Teachers in Willoughby and Eastlake are certainly doing their part. Listen to what they've done. The staff is now working around the clock in order to make face shields for healthcare workers and first responders that are on the front lines. The group got the call that shields were desperately needed, so they started making them on the 3D printer at the District School of Innovation Fab Lab. That's incredible. Right now, the staff is making about 150 shields per day for local workers who need them the most, and no doubt they will make a difference. And the Akron Zoo is helping with emergency efforts. The zoo posted on Facebook that they donated 1,400 N95 masks to the Summit County Emergency Management Agency. They had a bunch in their emergency stockpile, so they said, why not donate them? The zoo also registered 2 of the ventilators with the state registry, just in case any hospitals have a need for them. Just a few more of the examples of incredible collaboration we're seeing. Well, remember, we want to keep you up to date with the latest facts on the coronavirus and its impact. You can get a direct link to all of our coverage. All you need to do is text the word text to 216-344-3300. That's text the word facts, 216-344-3300. Text only, no calls. 3 News Connect is coming right back. time. They now have relaxation rooms where workers can relax and recharge. The rooms have mood lighting, noise machines, aromatherapy, and snacks. And they can pop in anytime they need to, either before, during, or after their work shifts. Well, we know you have coronavirus questions, and we're doing our best to get them answered. Here's Monica now with today's 3 News Connect Health Hub.
Joining me now in the Health Hub is Dr. Amy Ray, head of infection prevention at Metro Health. Do you think it's dangerous for a medical office to require a patient to come in for a urine screen or blood work?
If you have concerns about being exposed to COVID while you're in a medical setting, then that should prompt a call to your physician before you, or communication to your physician or provider before you arrive. But essentially, a conversation needs to happen there between you and your doctor, which carefully weighs the risks and the benefits of you coming in.
If you think you have the virus, what indicators make it serious enough to go to the hospital as opposed to treating it at home?
So the indicators for hospital stay should be if you are short of breath, if you feel like you're gasping for air, certainly if you have chest pain, if you're unable to maintain enough intake of fluids to remain hydrated. So if your urine becomes dark and you're feeling lightheaded, those could be signs that you're not adequately keeping up with your intake in terms of fluids and food.
What precautions do we need to take for delivery or pickup of groceries?
The interaction between you and the person dropping off your groceries should be so incredibly short. So this is not what I would consider an exposure, even if you're spending time with them. You'd have to be pretty close to them for at least several minutes, and that seems to me to be unlikely in that setting. And then the other piece of this is if they're leaving your groceries, the question then becomes, could you possibly contaminate your hands or your food from handling the bag or the contents of the bag? And that is very, very unlikely. This is a virus that doesn't like to survive for a long time on surfaces, but certainly after you're putting away groceries and before you're preparing food, hand hygiene would always be recommended.
Committed to bringing you facts, not fear. Monica Robbins, 3 News.
All right, Monica, Dr. Ray, thank you very much. Again, we know you have questions, and we're trying to connect them to our experts. Get them to us. Text your questions to 216-344-3300. Well, another example of a company stepping up to show its employees just how much they appreciate all of their hard work during this very difficult time. Tyson Foods is giving nearly $60 million in thank you bonuses to 116,000 employees. That includes its frontline workers and truckers. Tyson says workers can qualify for a one-time $500 bonus that will be paid out to them during the first week of July. And check this out. The Marriott in Warrensville Heights may be temporarily closed, but they're still spreading love. A worker there tells us the general manager sent this picture out saying, "Hope everyone and your loved ones are in good health. We are missing you all." 3 News Connect is coming right back.
The Pope prayed for anyone facing economic problems and unemployment due to the coronavirus pandemic. Italy, of course, is one of the hardest hit countries. And the Diocese of Cleveland is following Governor DeWine's stay-at-home order and suspending all masses through May. That would be May 3rd. The Catholic bishops of Ohio said the decision was not taken lightly and encouraged parishioners to virtually attend church through live streams and television services. This Sunday is Palm Sunday, the start of Holy Week, and some churches are offering Palm drive-through pickups. And while everyone is dealing with the stay-at-home order in their own way, one local man decided to do something a little out of the ordinary to put a smile on his neighbors' faces. Will Ewick has that story.
We've been here since '98, so 22 years.
You'd think after 22 years you'd know who your neighbors are. But since the shelter-in-place order,
we get a little funky, we get a little stir-crazy at about 7 o'clock.
Tom Roach decided to keep his neighbors guessing.
Every day since we're home, we'll walk our dog around and wave at the neighbors, and everybody knows us.
Those walks got a whole lot more interesting after Tom saw a video online of someone walking their dog in costume and decided to give it a go, thinking it might provide a little joy at a time that many could use it.
My wife thought I was crazy. I'm like, it'll make somebody laugh. They're all shut in. The kids thought it was funny, and I thought, I got another costume and all these Halloween costumes, and they just started doing it.
Tom's costume strolls through the neighborhood have become such a big hit that many are not just waiting to see what he's going to be dressed up as each night. They've started to donate to the cause.
Who is going to be walking Harper today?
The neighbor said, we have extra, princess costumes. I'm like, send it, I'll wear it. And now it's blossomed. The neighbors are dropping off costumes for me to wear, and so it's kind of fun.
Some costumes are superheroes, others celebrities, and some,
like the 20s or 30s flapper dress,
are just plain uncomfortable.
And I wore heels with it. I'm not a heel-wearing kind of guy, so my calves were burning by the end of the walk.
Nevertheless, Tom plans to keep dressing up each and every night during the stay-at-home order, which most likely will lead to his neighbors knowing him as...
Probably, that guy that wears the weird costumes, or,
In Westlake, Will Ewick.
If it breaks up the monotony of the day, then it's definitely worth it.
Bye.
3 News.
Oh my goodness, I love this guy. That is amazing. I was sitting there wondering, where is he getting all these costumes? And I just think it's great that all the neighbors are like, hey, here's mine. And I live in Westlake. I'm finding out where he lives. I got a bunch in my basement. I'm taking up to him too.
I think he makes a very good flow. And the other one that I noticed there, very quick shot of it, but he was Alan from The Hangover, and I noticed that because I was Alan from The Hangover one year for Halloween. It's a great costume with the baby. I mean, people know who you are right away. Hey, Monica, I want to turn the page to something much more serious now, and I know as this virus continues to go on, a lot of folks are trying to get any information they can on some sort of potential treatment that would help those suffering from it. I've read about the hydrochloroquine. I've read about plasma treatments, Z-Packs. Where are we on that, and is there anything hopeful on the horizon?
Well, the hydrochloroquine, as you know, the FDA approved it for clinical trials, but also in compassionate use cases, so under a doctor's supervision. But it's very, very important for people to remember this is not something that they can take prophylactically. And we've already had people die from taking chloroquine, which is actually a fish tank cleaner, just last week. So please do not take this if you are not prescribed. This medication is only meant for people in very, very bad situations and on ventilators in hospitals. As for, remember, University Hospitals is testing 2 new drugs in clinical trials. We have the vaccine being tested right now. There was a blood serum test to check for antibodies that the FDA looked at and approved last weekend. Still not widely available, probably going to go to healthcare workers first. And then, of course, remember, the entire world, every scientist, every brilliant mind in the entire world is scrambling, trying to figure out something in some way to battle this pandemic. So of all the times in our history that we have the best chance of finding an answer, it is right now. And I know everybody's thinking we need an answer faster than this. But remember, it's only been about, 96 days since we even found out about this virus. So we're doing pretty well for just finding out about something like this in 3 months.
Well, thanks for the update, Monica. I know a lot of people are really concerned on that front, and we will continue to keep people posted as we hear of these treatments that are being tested and even approved. Quick break. 3 News Connect is coming right back.
Hello, I'm Mike Lindell, inventor of MyPillow. Just like you, I had problems sleeping.
Before we get ready to go, here are 3 new headlines that a lot of you are talking about. Disney announces it will furlough its employees amid the COVID-19 pandemic. Browns wide receiver Jarvis Landry just donated $15,000 to provide hygiene products to families in East Cleveland. And Dr. Fauci, you know him as the United States' top infectious disease specialist. He's getting his own bobblehead. Find these stories and more at WKYC.com and on our app. Jay?
I think we need to get a bobblehead for Dr. Amy Acton. I think if anyone deserves a bobblehead, it's Amy. Okay, we know in times like these that we look to kindness from others to help ease the tension. And a local favorite restaurant, Swenson's, is trying to spread goodwill one galley boy at a time and helping feed those that are working tirelessly on the front lines.
We got food for $75. We got burgers, fries, and milkshakes. We regularly donate food to first responders and medical staff. We think it's really important to take care of those that take care of our community. So we're teaming up with Ricky, who's really awesome. He's part of RAKE, which is Random Acts of Kindness Everywhere. And he does this thing all the time.
So I've been doing this thing the last couple weeks since we're all going through things, try to bring lunch and kindness to people. And Swenson's reached out and they're like, how cool would it be if we work together to drop off lunches to different people, kind of unsung heroes. So the people who are on the front lines but might not be getting appreciated as much as everybody else right now. They don't have to be here every day, putting themselves on the line, also their kids, their families, not seeing their families. So it's cool to just provide some type of help for them right now.
We got milkshakes.
I'm not on the front lines, I'm not doing things that, are saving the world, but hopefully you can kind of virtually massage the backs of the people who are, and just hopefully motivate and inspire other people.
All right, guys, so we've got milkshakes, we've got burgers, and we've got fries.
I know that.
So wonderful.
The only thing I think that gets us minds off of this stuff right now is doing for others while staying at home. At times like this, it's cool to see everybody come together. It's cool to see the spirits and energy of people, and we're helping people.
So while we have to be physically distant, Jay, we can still socially connect. Thank you so much for joining us. We'll be here again on Monday for 3 News Connect.
Monica, have a great weekend. We'll see you Monday at noon. Reminder, we're back at 5 o'clock. Betsy Kling, the 3 News team, and myself with What's New. We'll see you then. Take care.
An accident with a truck can cause serious injuries.